So welcome to my presentation about the Spanish flu. This is my outline. Firstly, I present you my leading question. Secondly, I'll give you some general information. Then I talk about the origin of the Spanish flu. And after that, I tell you why the Spanish flu is called the Spanish flu. Then I present you the 3 waves of the flu and list the symptoms. I will talk about medicine and measures against the flu after that. Then I speak about the consequences of the Spanish flu and compare it to COVID-19. And finally, I answer my leading question and talk about things we could learn from the flu. Yeah, and then I will show you my sources. So this is my leading question. Why was the Spanish flu that dangerous? But first of all, let's go over some general information about the flu. The Spanish flu, was the worst global pandemic in history, therefore being even worse than the Black Plague. The Spanish flu raged during or at the end of World War I in 1918 and 1919. War was a big factor which helped the flu spread through military troop movements. The virus which led to the Spanish flu is called H1N1 and belongs to the influenza A subtype. The disease it arose had a mortality rate of almost 20%. 27%, so almost 1/3 of the whole world population got infected in that time. About 50 million people died. The exact numbers are unknown. But normally diseases are deadlier to elderly people because their immune system is weakened already. But the weird thing about the Spanish flu was that it hit young and healthy people the hardest. But how did the disease spread and where was the origin? Well, this is not clear. Scientists and experts are still trying to find out the real origin. Possible origins are France, USA, China, Austria, and East Asia. One of the most likely origins is USA, Kansas. There was a military camp, and on March 11, 1918, a cook named Private Albert Gitchell woke up feeling sick. So he went to a nurse, and after him, a soldier went to the same nurse with the same symptoms. The disease then spread under the soldiers, and due to the war, the soldiers brought it to Europe and the rest of the world. Another theory is that the Spanish flu originated in France at another military camp in Etaples. The flu spread from the poultry at the camp onto the pigs, and from there onto the humans. So, at that military camp, many soldiers suddenly felt sick and went to a hospital camp where the doctors found a flu-like disease with a high mortality rate. But why is the flu then called Spanish flu and not Kansas or French flu? Well, first you need to know that during the war, the media in the participating countries was censored. These countries concealed the flu and played it down. One country which remained neutral during the war was Spain. So their media reported on the flu pretty heavily and with a great attention. This led to people thinking of Spain being the origins of the flu, which isn't true. So now let me present you the 3 waves of the Spanish flu, because the flu didn't rage just once. As you can see, there were multiple waves occurring from June 1918 to March 1919. The first wave in summer led to many people being infected, but actually they recovered pretty easily. The mortality rate of the first wave was more similar to the one of a seasonal flu. Still, 3 to 5 million people died. Then the second and deadliest wave started in fall. This was where soldiers moved around the globe. English ships arrived in South America, France, and in Africa, bringing the disease to new places. It's said that during the second wave, 2 out of 3 persons were infected. In that time, almost 50 million people died of the flu. Then there was the third and last wave. The numbers to the third wave are pretty vague and partly missing. This wave was the least deadly. This wave was least deadly of them all. Actually, there were many infections, but not that many deaths compared to the waves before. Most people were immune now and strong enough to fight off the virus. The number of deaths during the third wave is unknown. But how did the disease affect the body? Which symptoms occurred? So, in the first wave, there were symptoms like body fatigue, earache, diarrhea, and also fever. In the second and third wave, there were some additional symptoms. Vomiting, nose bleeding, shivering, and lung complications could occur during the course of the flu in the second and third wave. The lung complications later would lead to bronchopneumonia, where the lungs would fill up with fluids from the body due to an overreaction of the immune system. Patients would then drown in their own body. And now to the medicine. Unfortunately, there were neither effective drugs nor vaccines which could cure the patients at that time. Doctors recommended taking aspirin, quinine, arsenic, morphine, heroin, mercury, and camphor or castor oil, all in deadly doses. People actually died more when taking any of these substances with those doses. Well, also, doctors encouraged people to smoke because smoke was supposed to kill the germs in the body. Well, that was a lie. But today things are different. Today there are drugs like oseltamivir or zanamivir which can improve the health status during a flu. Also, there are vaccines against the flu, such as Pandemrix, Panvax, Calvipan, and Phocetria. But if the people had no drugs or vaccines, how did they fight the flu then? Well, in Europe, countries like Germany, France, and Great Britain closed some of their schools. Quarantine and staying home was recommended, but not for workers. Economy was way too important for the governments. In general, hygiene played a bigger role, and public gatherings were cancelled. People had to wear masks and should wash their hands more often. In the United States, every state fought differently. In Philadelphia, for example, a big military parade still took place, which then led to 3,000 deaths and 10,000 infections in the next days. In Missouri, streets were empty, and people were actually told to stay at home, which they did. So now to the consequences of the Spanish flu. Due to overwhelmed hospitals, gyms and other facilities were transformed into hospitals. There were also high labor shortages due to the many deaths and measures against the flu. Therefore, there was a wage increase for the workers. Also, businesses shut down because too many workers got sick. Employers use social security systems more and more, and afterwards, research has shown that people who were born in the time of the Spanish flu got many disadvantages in life. They had lower educational attainment by adulthood, experienced increased rates of physical disability, enjoyed lower lifetime income, and a lower socioeconomic status than those born immediately before and after the flu pandemic. Another consequence from the Spanish flu was that health systems got better. And now, how does the current COVID-19 pandemic compare to the Spanish flu of 1918? So, the Spanish flu definitely had a higher mortality rate than COVID-19 has. But we also know, no, still the infection rate of the Spanish flu isn't as high as the one of COVID-19. But we also know that the infection rate of COVID-19 is going down at the moment. Then we have to compare the social situations where the pandemics took or take place. The Spanish flu raged about 100 years ago. At that time, medicine was not that advanced as today. We have so many more possibilities and science works really fast today. So cures could be produced faster. This would be a big advantage for the fight against COVID-19. Scientists at the time of the Spanish flu hadn't got such technology. So the flu spread faster and couldn't be controlled. Also, war was going on, and soldiers moved to other countries, spreading the disease more and more. Today, borders are closed. There are no flights arriving in countries and no flights taking off. The people stay in their countries. Also, the governments are acting better today than in the past. They warn the people and give measures to decrease the spread. And now to my leading question. Why was the Spanish flu that dangerous? Well, first, as I said, the situation were really unfortunate. War was raging and there was constant mobility from troops. Also, the governments did not act well. They ignored the disease and pushed the people so that the economy wouldn't fail. Then there was the mortality rate, which was super high. And the lack of drugs or vaccines made the disease more powerful. Also, the lack of technology contributed to the increasing power of the virus. So finally, what can we learn? What should we do different and what should we watch out for? So I think governments learned their lesson with the Spanish flu. They should never lie to the people and always inform the people on what's going on. They should warn the people but also motivate them to help decrease spread. They should address social distancing and point out the importance of it. The number of deaths and infections of the Spanish flu were mind-blowing. For a big part, this was the fault of the governments. They lied to the people. People had to work and there were still some events taking place. The governments cared more about their economy than about the health of their people. Governments should trust in the people, but also pass laws or measures like lockdowns and quarantines. Also, the governments should watch out and be prepared for more waves or new pandemics or epidemics. If the coronavirus should retreat, we should still be prepared for more waves. This is important to understand. And this is also the end of my presentation. I hope you had fun listening and could follow me well. These are my sources, and if you got any questions, just ask me. But I hope there are none, and I hope everything is clear. Tschüss.